Now I'm going to go over my coronary CT workflow very briefly. What I have on the screen right now is after I've selected the appropriate series from the patient list and activated the cardiac workflow. When I do that, there is an automatic prompt asking if you'd like to automatically remove the bone, and I said yes. And it's a pretty decent removal of bone. So I'll just keep it. You can see window and level to make it better looking and bring out the coronaries more. So when I'm happy with that, I'll use the batch tool to do a 360 spin or just follow the arteries instead of a 360 spin and send that to PACS. Then I look at the origins, courses, and terminations of the coronary arteries, making sure there are no anatomic anomalies, especially in younger patients, and I see none in this patient. We can also evaluate the coronaries themselves for any disease on the source axial images. Let's say you're suspecting a certain segment. You can Alt and left click to put the crosshairs there and make sure you're orthogonal to the long axis of the vessel by adjusting the crosshairs accordingly. So now I have a true cross section of the LAD over here, and I can scroll through that area again, making sure the orthogonality is maintained. If it's not, I'll just need to adjust the crosshairs accordingly to make sure it is. And we can do that for each of the coronary arteries for any suspicious segment for disease. I'm going to reset this. After that, we can now get the curved planar reformat, reformatted images, and these middle row icons are actually automatic CPR tools for the specific vessels as labeled. If the acquisition is reasonable, they should automatically produce the center line. So let's try the RCA. In this case, left click that. And there you have it. Despite some motion artifact actually along the RCA, as you can see here, some boomeranging, you still got a pretty good center line, except at the very tip, we were kind of veered off or maybe ended up in a branch actually. For now, I'm gonna hide all the labels and center line and double click here to kind of assess the RCA where we have the center line for any apparent stenosis. You can change this to a straight MPR instead of a curved one. Probably easier to spot stenosis this way. And you can just go back to the actual curved planar reformat when you're satisfied. And yeah, assess the lumen as well on the actual transverse kind of images or axial images through the center line. And we have them here, and these are orthogonal kind of images. So I'm scrolling down through the center line, and you can actually activate the labels again to see where you're at. And I'm using A right now to move down. Some motion again in this patient. And if that's the case, you probably have to load another phase if it's a retrospective gated study to get clear images of that segment of the RCA and then investigate that segment on the other phase or phases. So just march down, and then we can do this for each vessel. And by the way, even before looking at the lumen for disease, once you have this nice center line, you can send the batch of CPR images using the batch tool, like we talked about before, and send that to PACS for each of the vessels. And let's see if we can get LAD. yeah, we still kind of got it. Pretty reasonable center line through the LAD right there, and we'll just do that for each of the coronaries, the LCX, and again, look for any significant stenosis. And when I'm done looking at the coronaries, of course, it's time to look at the rest of the images. First, the heart, including the pericardium for any abnormalities, and then the great vessels, and of course the lungs and the rest of the thorax that's imaged and within the field of view. So that's a brief overview of my workflow for the coronary CTA.